What can you do to prevent these little ear crystals from getting loose in your semicircular canals and causing vertigo? My name's Amy Moore. I'm a vestibular physical therapist, which means I treat vestibular conditions, including semicircular canal crystals, also known as BPPV. This is part 14 of my BPPV playlist, where we discuss what can you do to prevent BPPV. There's a few things that I want to talk to you about as far as what causes BPPV so that we can talk about what makes sense to prevent it. First of all, there are some causes that you really can't prevent. Those things we can't prevent include our genetics, aging, our gender, being female actually causes more recurrences, hormones, and trauma. But there are some things that we know cause BPPV that are somewhat treatable and preventable. The first one being inactivity. We know through studies that people who are generally more active tend to have less recurrences of BPPV. For staying active, the American Heart Association recommends 30 to 45 minutes of physical activity per day, 5 days per week. Physical activity involves repetitive movements like walking, jogging, swimming, biking, dancing, anything you like that gets your heart rate up and gets your body moving. The next thing that may be treatable or preventable that causes BPPV includes underlying conditions and infections. If you have chronic allergies and autoimmune conditions that affects your ear health, you need to get with your ENT to implement treatment strategies to help manage these conditions. If you have other underlying conditions such as high cholesterol, high blood pressure, or diabetes, you may be at higher risk for BPPV. So in that vein, executing treatment strategies for those underlying conditions to better manage them can help prevent BPPV as well. And finally, there are vitamin deficiencies that we know can contribute to developing recurrences of BPPV. Specifically, if you have low vitamin D levels and those vitamin D levels are corrected through medications and supplements, you may have a lower recurrence rate. It is recommended that you get between 1,000 and 5,000 milligrams of vitamin D or vitamin D3 every day. Getting proper amounts of vitamin K2 can help that vitamin D to get absorbed and utilized properly inside your body. Getting between 100 and 200 micrograms of K2 per day is recommended. And also, maximizing your levels of magnesium has been shown to improve vestibular health. The proper amount of magnesium to get per day is between 300 and 420 milligrams. It is not recommended to start even a supplement without your doctor's permission because they can interfere with your existing medications. Get with your doctor to have your vitamin levels checked so that they can make the proper recommendations about what medications and supplements are right for you.